Hotspots, lockdowns, doom-scrolling. Words like these have become all too familiar, haven't they, as we try to wrap our collective minds around what is this deadly fact. COVID-19 spiraling out of control around the world. And that means more than catchphrases. In Europe, it means a rising death toll and plenty of political hand-wringing. Let me try and break this down for you. You will recall that Italy was one of the hardest hit European nations early on in the pandemic. Then it got a grip on the spread. Well, now it's the 10th country in the world to surpass 1 million confirmed cases of coronavirus. In France, where you now must fill out a form before leaving home to buy groceries, the number of new cases is still rising. The virus doing what it wants, despite the country's latest lockdown. And I want to show you the bleak new milestone in Britain, a death toll surpassing 50,000 people. And that's the point as we connect the world. This crisis is about people, families, loved ones, not just numbers on a chart, of course. CNN's Ben Wiedemann standing by for us in Rome. I want to get to Salma Abdulaziz in London, though, first. Let's start with you, Salma. What's the UK government been saying?
Well, Becky, again, just to emphasize here, this grim milestone, 50,000 people who have lost their lives. That is not proportionate. 9 out of 10 of those victims is someone over the age of 65 years old. And it's not just about the death toll. We're seeing about 20,000 new cases per day across this country. And we are 1 week into a nationwide lockdown. So this is a major blow and something that the Prime Minister, Boris Johnson, of course, had to address when speaking to reporters yesterday. Take a listen to what he had to say.
We're very much hoping that two things will start to come to our aid. Number one, the mass testing, the kind I just described, the rapid turnaround testing. And then the other thing is now the prospect, the realistic prospect of a vaccine. So you have a kind of, as it were, two boxing gloves to pummel the disease in the weeks and months that follow.
And you are hearing there his twofold strategy. The Prime Minister is essentially saying part one of my strategy is mass testing. This idea that the government has that they will roll out widely available testing for free to anyone, regardless of whether or not they have symptoms, and people would be able to get tested regularly and normal life could resume. Now, that's already begun. There is a pilot program in Liverpool. It's been about 6 days there, and the turnout so far has been low. It's very far from this idea of everyone gets tested because it's not mandatory. The second part of the strategy that Prime Minister Boris Johnson is outlining there is the vaccine, this very promising vaccine that we're all hoping, waiting, and wishing for, but as we know, will not be widely available until next year. So what we're looking at is a Prime Minister who has very limited tools left in his toolbox. And the question is, as we head into the Christmas months, as we head into the holiday, we already have all these restrictions in place. We've already put a lockdown in place. Masks are already mandatory in this country. All these tougher measures have already put into place. So what else can the Prime Minister do? And there's two ways to look at this. There's the optimistic way to look at this death toll, which that there is a lag in numbers and that maybe in a few more weeks the cases will begin to slow down and things will look better. But the sobering and concerning reality is that these numbers are indicative of something larger and the country simply does not have a grip on the virus. Becky?
Well, Salma is in London for you, Ben. 1 million cases, not a number anybody in Italy, nor anybody in Europe would want to see. What's the mood in the country?
Really, people are bracing for things just getting worse. In fact, one of Italy's leading epidemiologists has said that at this point, the pandemic in this country is largely out of control. And when you look at that number, we tipped over into more than 1 million cases yesterday. More than 600,000 of those cases are currently active. That is 5 times more than 5 times than you had at the height of the pandemic earlier this year. And what we're seeing is that if you remember back in March and April, Italy was really, the Italian hospitals were grappling with trying to meet the demand for beds in intensive care units. they've managed to increase dramatically the number of beds available in the ICUs. The problem is they don't have the staff to deal with the number of people coming in. So we're seeing, for instance, that some hospitals are sending their not critically ill COVID patients to hotels that have been converted into hospitals for those who don't need intensive care but do need treatment because of coronavirus. So you have these dramatically increasing numbers. These are numbers that really dwarf what we saw earlier this year. Now, we're expecting in the coming minutes the latest statistics, but yesterday, Wednesday, saw the number of deaths from coronavirus, 623 in a 24-hour period. That is the worst number we have seen in Italy in 7 months, and similar to the situation that Selma was describing in the UK. The government is implementing slowly more and more measures. You have now an overnight nationwide curfew, mandatory masks. You have 5 regions in the country under lockdown and others going in that direction. But these measures don't seem to have really had an impact on this pandemic, this second wave of the pandemic.